أهلا ومرحبا بكم أعزائي المشاهدين في حلقة جديدة من برنامج ضيف وقضية. ما تزال الأمراض القلبية وبالرغم من التطورات العلمية المتقدمة جدا أكثر الأمراض فتكا بالأشخاص المصابين بها نساء ورجال. وتؤكد الدراسات والاستطلاعات الطبية أن أعداد ضحايا الأمراض القلبية تتعدى أعداد ضحايا الأمراض السرطانية بجميع أنواعها. وفيما يعاني المصابون من التأثيرات السلبية على أوضاعهم النفسية، يعاني أفراد أسرهم المقربون منهم من القلق والترقب، وتتأثر حياتهم سلبا بطرق وأشكال مختلفة. وينصح المختصون بأن من أولى أولويات المحافظة على صحة القلب تكمن في اعتماد ومراقبة غذاء صحي ورياضة جسدية منتظمة يساهما في التخفيف أو الحد من نسب الإصابة بأمراض القلب والجلطات الدماغية بنحو 80%. الدكتور شكري ديفيد أحد أشهر أطباء الاختصاصيين في الأمراض القلبية هنا في ولاية ميشيغان، يخدم في العديد من المستشفيات، منها مستشفى بروفيدنس في ساوثفيلد ومستشفى سان جوزيف في أن أربر. أعزائي المشاهدين، أهلا ومرحبا بكم مرة أخرى في حلقة جديدة من برنامج ضيف وقضية، ونحن نستقبل الدكتور شكري داود الطعيمي، الاسم باللغة العربية. دكتور شكري ديفيد هو أحد أشهر أطباء الأمراض القلبية كما ذكرت في المقدمة في ولاية ميشيغان، وأيضا أستطيع القول في الولايات الأمريكية الأخرى. له نشاطات لم أذكرها في المقدمة، نشاطات تتعلق بمبادرات المساهمة في تنمية وتقوية مجتمع ولاية ميشيغان من خلال عضويته في العديد من مجالس الإدارة في الولاية لمنظمات وهيئات تعنى بالشؤون الصحية. هو أيضا مستشار للقناة التلفزيونية السابعة Channel 7، يظهر باستمرار حينما يجد أي موضوع يتعلق بالأمراض القلبية. وأيضا هو مستشار للقناة التلفزيونية الثانية، يطل علينا كل أسبوع أو كل ما يجد ويستجد من أو قضايا وأمور، إحصاءات ودراسات تجريها المؤسسات الصحية والمؤسسات الطبية والجامعات في ولاية ميشيغان. يقوم بتوعية وتثقيف جميع المواطنين في ولاية ميشيغان عن الأمراض القلبية تحديدا. وهو أيضا عضو في العديد من المنظمات، وقام بإجراء الكثير أو بإنشاء الكثير من المبادرات في بعض الدول العربية، لبنان والأردن، وتحديدا في الأردن على ما أذكر منذ تسعينيات القرن الماضي، حينما أنشأ مع عدد من الأمريكيين منظمة تسمى كويست سكوب، وأيضا العديد من المنظمات التي تعنى بشؤون حياة المواطنين الأردنيين في مسقط رأسه في مدينة لفحيص في المملكة الأردنية الهاشمية. تحدثنا قبل قليل عن هذه المنظمات التي تعنى بشؤون المرأة في لفحيص. طبعا الحديث يطول عن الدكتور شكري ديفيد، ربما بحاجة إلى ساعات لتغطية كافة نشاطات الدكتور شكري، لكننا سنستغل هذه الدقائق القليلة القادمة في الحديث عن الأمراض القلبية بشكل عام، وماذا نستطيع أن نعمل نحن كمواطنين للحفاظ على صحتنا بشكل عام. I would like to welcome you, Dr. David, to our show, and thank you very much for giving us the opportunity to come here and to educate our community about heart diseases and heart problem. Thank you.
It's my privilege.
Dr. Shukri, heart disease, it's well known, the number one killer in the United States of America. And maybe you know that in the world, it's equal, maybe more than all cancers combined.
In the United States, it is the number one killer, not just of men, but the number one killer of women.
Okay.
So many women feel that it's breast cancer, it's uterine cancer, it's auto accidents, it's other. But actually, if you take the top 5 causes of death in America, they do not equal cardiovascular deaths.
Wow.
So heart disease is very prevalent, not just amongst men, but
Sure.
amongst women, especially women post-menopause. Not only do they catch up to men, they actually exceed men after a certain age. So it is a community
deadly.
hazard. Right?
Sure. Dr. David, we want you to shed some light to explain to our community members basic information about human heart.
Sure.
How is the structures and function?
Sure.
All basic
Well,
information.
the heart is a muscle. And muscle requires oxygen and nutrients to run. Just like an engine requires fuel, the heart needs nutrients. Those nutrients get to the heart through arteries. We call them coronary arteries.
Okay.
These arteries supply the heart with blood. If there's an obstruction in the artery, suddenly patients have a heart attack because the muscle doesn't get the oxygen nutrients it needs. And if not treated rapidly, irreversible damage occurs or death. So unfortunately, half of all patients that die from heart disease die before we see them. It's called sudden cardiac death. And you hear about it all the time, family, friends. Some very famous people recently suddenly died. Unexpectedly, presumably quite healthy. So it can happen. It's usually death within an hour. So that's the other symptom with the narrowing is that there's a blockage. And when there's a mismatch between supply and demand, like let's say you walk up a flight of stairs, you have chest pain, you stop, it goes away. That's what we call stable angina versus an unstable situation where it's sudden onset with no effort. So the other aspects of heart disease, excuse me, that we deal with is heart muscle disorders. It's what we call heart failure, where the muscle normally contracts and removes about 5 liters a minute of blood. Well, in patients who have heart failure, they are only removing less than half of that. So they're at a very high risk for what we call sudden cardiac death or arrhythmias, or they're just incapacitated because they can't meet the demands. And the heart can't meet the demands of the body. So they get very short of breath, they can't sleep flat, they need pillows, their legs swell. The third aspect of heart disease that we deal with regularly are the electrical circuit problems of the heart. These are the rhythm disturbances. So we have various specialists, they're called electrophysiologists, that deal with the complicated rhythm problems. But one common rhythm problem that we see a lot is atrial fibrillation. This is an irregularity in the upper chamber of the heart. And about 1 in 10 members of our community over this age of 75 or 80 have this problem. And it's usually not a problem. Many times patients don't even know it. But
it used to be a problem before, maybe?
Well, it is a problem because it's one of the leading causes for stroke. So that's why we have to pay attention for it. That's why people at that age have a much higher incidence of strokes. And so if you're over the age of 65 and you have this rhythm problem, you're at an increased risk for stroke. So that's the third aspect that we deal with in cardiovascular medicine. Rhythm problems, heart muscle, and coronary arteries. It's probably 95%.
How about, I was told just recently, I'm not sure whether this accurate information or not, that the heart, just like the brain, have 2 sides of it, left side and right side.
Absolutely. Oh, yes,
and the right is slightly smaller than the left. Can you explain that?
No, the right and left pump the same amount of blood. The right ventricle is the dark blood, the blue blood. The left ventricle is the red blood. The dark blood is the deoxygenated blood. It has a lower oxygen content because it comes from the legs and brain. It then goes to the lungs where it's oxygenated and then comes back to the left ventricle and pumps oxygenated blood to the body. Where is this a problem? It's usually a problem in infants. If they have little holes in their heart, then the dark blood, the deoxygenated blood, gets into the left side and these babies are blue. And so they're not oxygenating well. But generally the right ventricle and the left ventricle pump the same amount of blood, oxygenated, and comes back to the left side.
We, doctor, as a people, the people who are watching us tonight, wherever they are, whether in Michigan or over the United States or Canada, what they have to look for when they are concerned about their heart, especially the sign that it will lead to a problem?
Heart disease begins at a very young age. And how did we know that? Well, In America, they studied the Korean War,
Okay.
the boys that were killed in the Korean War. They got autopsies. And when they looked at their hearts, they started seeing little plaques building up at the age of 18, 19, and 20. Kids that are in motor vehicle accidents, and they happen to have had a head injury, do not recover, they donate, their hearts are donated. We look at those hearts and we see that there's disease in these arteries at a very early age. So heart
For
disease...
each and every one, or certain people who have within the family
Well,
issues?
there are people that have certainly risk factors,
Okay.
but many times the disease begins very, very early in age. So that's how we learn about this. One of the biggest... So when you talk about how do I know, you have to know if you're at risk or not.
Okay.
So if you don't smoke, if you have a good family history, your mom and dad are healthy, they lived a nice ripe age, no immediate family members of heart problems, there's no diabetes, you don't have high blood pressure, your cholesterol numbers are good, you should know your numbers. So remember, know your numbers. What are your numbers? You should know your total cholesterol. You should know your bad cholesterol number, which is the low density lipoprotein LDL, and you should know your good cholesterol number, the HDL.
Okay.
And
The LDL
HDL is high density, and that's the good cholesterol.
and the other is the bad.
And the estrogen is the bad one, and the triglycerides. So know those numbers. So if you don't have those risk factors, you're probably at a very low risk for having a cardiac event. Now this is the problem with our community, and we're now seeing it actually in Jordan. They have, all of these coffee shops have ergile, or these hookahs. We have seen about a 50% increase in cancer rate over the last 20 years in Jordan. The cancer rate in young people is staggering. Heart disease. In America, we're putting a big emphasis on a healthy lifestyle. Over there, everybody smokes. They even, when you go to the homes, have cigarettes in a bowl with all different types and varieties and offer to
Their duty to offer.
Yeah, well, it's a terrible offering, because we're seeing early cardiovascular death in young people in their 30s and 40s and 50s in Jordan. It's a habit that's happening here with this hookahs, they call them here now. And so all of this smoking is the equivalent, one of these bowls of hookahs is equivalent of a pack of cigarettes or more.
And
So-
they say as long as it's does not smell like smoking, it's not going to affect your body.
It is one of the most significant risk factors that you can have for heart disease. So when you ask me who's at risk, know your risk factors. Some of the symptoms, and again, they vary a little bit between men and women. Most often, it's you just don't feel right. You don't have enough energy. You're short of breath. You used to be able to walk up a flight of stairs at your home and you felt okay. Now you get a little more short of breath. Or when you walk from your car to work, you're feeling a little more tired or short of breath. Shortness of breath, nafas dhayiq, is one of the things. The other things are heaviness. When you have tightness in the chest, sidrak bkun thqil, pain in the arms or the jaw. Those are some of the signs.
In both arms or in one
It can be one or both. It can be
Okay.
the back. Many times women will present different. Men will say, I have something sitting on my chest, I can't breathe, etc. They're easier to pick up, whereas women, they can't do the work that they usually do. When they go to work, they're more tired. Rather than having chest pain, they might have back pain, they might be short of breath. So you have to really pay a little bit more attention to women than men as far as detecting some of the symptoms and signs.
Sweating, maybe, sweating.
Sweating is one of the signs. Usually that's kind of very late on in onset. Usually many times we see that with a heart attack. When a heart attack does occur, it feels, if you've had your blood pressure checked, you feel the tightness in your arm. Well, imagine the tightness around your chest or pain. And then you can have nausea, you can have vomiting, and you can get very diaphoretic or
Dizziness,
sweaty.
maybe.
Dizziness if the blood pressure is low, absolutely. And sometimes you can pass out.
Snoring? No.
Well, snoring is not
Because
a
I
symptom.
snore. I use nowadays
Well, the problem
CPAP.
the problem with snoring is that sleep apnea is associated with obesity many times.
Okay.
It is associated with hypertension, with diabetes, and patients are at an increased risk for having cardiac events.
Do you have to look at all that you mentioned, these signs or risk factors, or one is enough? Like if you have dizziness, if you have shortness of breath, that would maybe
Absolutely,
suspect
absolutely.
that.
For example, I've just had a young executive who had really no risk factors other than his cholesterol is elevated. He
Sure.
walked for 11 minutes on his stress test, but just didn't feel right. There are some special tests that, short of a coronary angiogram, you can do, for example, a cardiac CAT scan.
Okay.
We can do some of the screening that can give you very early detection.
These
for
are
heart
fairly
disease.
new technique, or it has
Fairly,
been
they've been around, but they're fairly new in approval.
Okay.
For example, I'll give you a good example. We have two recent presidents. One had heart surgery, President Clinton,
right.
a Democrat, by the way, and one had a coronary angioplasty, President George W. Bush, a Republican. Heart disease doesn't discriminate. It affects everyone. Both of these presidents had absolutely the best health care that America has to offer. They had stress testing. They had every year, they march the president in front of the cameras and say the president's in good health.
And they celebrate Valentine.
And so guess what happened? They both wound up with a cardiac event. Had they had these screenings earlier, this disease would have been detected much sooner, some of this technology. So there is some testing that we can do to pick up disease much earlier. And most hospitals, at Providence Hospital, for example, we offer screenings for literally $60. You can come in and get a screening, or $70 get actually a scan of your heart to look for calcium and hardening of the arteries. One of the best tests that you can possibly have. So there are many tests that we can do to intervene. But going back to your question, if you're having chest pain, if you're short of breath, see your doctor and get an evaluation. An electrocardiogram is a very simple test.
I also, just to follow up on the shape and the structure and the human heart, does the shape of the human heart the same of women and men, the same thing? They are no different as far as shape is
No
concerned.
difference. There's some thought that the women
and the
might
function is no different.
Absolutely, all the same. And maybe women might have smaller arteries, but in general, your heart's about the size of your fist.
Okay.
And it's pretty much the same.
At what age, Dr. Shukri, one should really start worrying about it, even if does not, if he have no issues within him, the family, and everybody around him? At what age? 20, 40, 50, 60, or when the signs appears?
Obesity is widely prevalent in our community, especially in young kids. So we really need to start very early with education about risk factors. Kids are generally protected up until puberty, and then of course the boy's testosterone goes up and the girl's estrogen. At that time, actually that's why girls up through menopause are protected because of the estrogens. And the boys, their HDLs go down, the good cholesterol, because of the testosterone. But you really need to be mindful very early, especially with college kids and what they're eating and smoking. Because this plaque, as I mentioned earlier, begins at a very early age and builds over decades. And if you're exercising, you're eating well, you're staying on the light side, slim side, you're keeping your body mass index somewhere between 25, 26, the likelihood of you having a cardiac event is very, very low.
Really?
On the other hand, if you're a teenager, or there are many teenagers, they don't look at it, smoking the hookah, as a cigarette. But if you're smoking and you're not eating well, you might be looking at a heart event in your 30s and 40s rather than when you're 70 or 80. So it really should start at a very young age as far as being mindful of it. As far as testing, really, it depends on the risk factors and your symptoms. Generally, we don't start doing stress testing unless you have a certain occupation, like a bus driver,
Sure.
or if you fly a plane, or you have the public at risk or safety, truck drivers, etc., then we might start some testing earlier on.
You mentioned obesity, Dr. Shukri. I was told that almost 13 million people, which constitute approximately 16.9% in the United States of America, they are obese.
Yeah.
Also, children aged 2 to 19, they are obese in the United States. Nearly 1 in 3 children, 38.1%. More than 1/3, about 35 of U.S. adults are obese. How do you, as cardiologist, how do you perceive this kind of information when we are in the most sophisticated country or society in the world? Information is all over TV, wherever you want, the information is there, especially when it comes to health issues.
Well, obesity is an epidemic in America, especially in Michigan.
Sure.
We have cold winters. People don't get out. They gain weight in the wintertime. Compared to, let's say, La Jolla, California, or San Diego, where there's a lot more walking, etc. But it has to do, and so you're absolutely right. In addition, Hispanic and African Americans are approaching 50% as far as obesity.
Wow.
So when we talk about overweight, there's ideal body weight, which is what we call the body mass index, where you look at your height, sex, and weight.
Sure.
Between 20 to 25 is ideal. Between 25 to 30 body mass index, you're overweight. Over 30 body mass index, you're obese. So when you talk about obesity, you're talking about a body mass index of over 30.
Wow.
So what comes with obesity? Well, diabetes. What comes with obesity? Hypertension.
So it caused diabetes?
Yes, absolutely.
Okay.
Your body produces a similar amount of insulin. It's just that the insulin is not enough to take care of the rest of the body. And so hypertension, diabetes, what does hypertension, diabetes lead to? They lead to stroke and heart disease. And so generally, and it's just really bad habits, not enough exercise, and poor dietary habits. So for me, I had to make a personal change. My mom is a diabetic. My dad is a diabetic. As you mentioned earlier in your program, I have a very busy clinical practice. We're a major teaching hospital, so I have an academic and obligations. And in addition, we have one of the biggest cardiovascular service lines in Michigan for cardiovascular medicine. It's not an excuse, but many times my meetings go very late into the evening. And most of my meetings are with food. And so I come home and I'm tired.
Especially with Arabic food.
Well, you know, I'm eating not always
No,
Arabic
I'm talking
food.
about before.
In our
Before,
culture,
yeah.
we're eating and we're sleeping and we're having knafen and there's not much activity. So I decided to make a change, and one of the biggest changes really is understanding what you take in and what you eat is who you are.
Sure.
And so you need to lose about 3,500 calories for 1 pound.
Okay.
So if I need about 2,200 calories a day, if I take in 2,200 calories a day, I'll be neutral and I won't lose anything. However, if I exercise for 30 to 45 minutes, I'll probably burn 500 calories. Over a week, I'll lose a pound if I just eat the way I'm supposed to. If, however, I take in a little bit less calories, let's say 500 less, and I exercise every day, I'll be losing 2.5 pounds a week. So it's about the calorie intake and what you eat. So for example, this is a diagram of the stomach, William. Here's your stomach.
Right.
If you eat, let's say, oily, fatty foods, this amount of, this is what occupies your stomach, 400 calories worth will occupy this amount. The rest of your stomach is empty, so you're feeling hungry.
Right.
If you eat beef, let's say, people say, well, I'm just going to go on a high-protein diet. If you eat beef, you're only filling your stomach about with this amount, and the rest of your stomach is empty, so you're still going to eat more calories. However, if you eat 400 calories worth of vegetables, you fill your stomach, and then have a little bit of the chicken, beef, or fish with it in moderation.
I do that, but I still continue to be hungry.
Then the other,
especially if I don't eat bread.
Yes, and so you back off, but you don't, there is bread, there's 35 calorie slices of bread. You can limit the number. You don't have to cut out carbohydrates completely, but cut it down. A low carbohydrate diet
Rice,
with
right?
lots of vegetables. Cut out the rice, cut out the pastas, lots of vegetables. I mean, look, people say, well, you can't build any muscle. Well, you know, horses have muscle. Cows have muscle, and they don't eat beef. They don't eat, you know, lots of vegans out there that don't eat any, you know. My dad fasts for 40 days before Christmas and 40 days before
No
Easter.
meat, nothing.
No, nothing from an animal product. So you can do it, but really it's about counting the calories and exercising. Now, let's talk about something else that I think is very helpful. If I had significant risk factors for heart disease and I'm morbidly obese, my body mass index is 40, let's say I'm 300 pounds or 350 pounds, and many members of our community are,
Sure.
and I'm at risk for having heart disease. And you've tried, and most people will fail in their diet, trying diets. They
Sure.
it will not work for them. There are alternatives. One non-invasive new alternative is what we call a gastric balloon, where you put a balloon
Inside your stomach?
They put a balloon into the stomach, they inflate it, and it sits in your stomach for about 6 months. And it gives you this feeling of fullness.
Okay.
So that way you don't feel hungry.
Okay.
And most patients lose about 30 pounds on this.
Is this
That's a-
outpatient?
It's an
operation?
outpatient procedure, takes 10 minutes to
No
put in.
surgery. No, I
No
mean there is no
surgeries.
cut or whatsoever.
Nothing.
Okay.
It's done at Providence Hospital. We we put the balloon in, inflate the balloon, leave it in your stomach. 6 months later, it comes out. That's one option.
Okay.
Another option that's a very good option is what we call a gastric sleeve. It's a
Okay.
surgery. But it's not the complicated Roux-en-Y intestinal switch type of surgeries. That your stomach basically looks like a pear.
Sure.
And what you do is you make it look like a banana. It's called a sleeve, just like a jacket sleeve. So all they do is they come and they cut part of your stomach out and make it smaller. I have had so many patients come to me and say thank you,
Wow.
because they now have lost 70 to 100 pounds. I've had one patient 150 pounds. And all of a sudden, imagine carrying 150 pounds on your back all day long where you go. It's now that weight
So
is
you
gone.
literally cut the stomach?
Cut the stomach out, and then when you eat, when you're hungry, there are receptors in your stomach that
Right.
says, I'm hungry still, and sends this message to the brain, and you
Sure.
want to eat.
Right.
Well, when they do this operation, all of a sudden, even if you wanted to eat, you can't. You will feel full. You won't feel hungry.
Because your stomach is smaller than before.
Well, it doesn't feel it. So you
Yeah.
don't miss the food. You can still eat what you like. You just can't have big portions.
Even Mansaf. you
Even
can.
Mensa, except instead of a big ball, you make a small ball with your hand.
Okay.
So those are some of the things that you can do to help. And this is a slide, by the way, borrowed from Dr. Kim Williams. He's
Oh, wow.
he's one of the premier cardiologists at Rush University, and he was recently spent some time with us, and we had this nice dialogue at a Middle Eastern restaurant and talked about this.
And in order, doctor, to follow these advices, you have to consult with your doctor, or you can do it on your own.
Well, look,
I mean,
just
not,
like,
not the operation. I'm talking about to follow the right style of life.
Google. All my students now carry their little devices with them. We have questions. There's so much information out there. There's no
Okay,
excuse.
sure.
But obviously, if you're having symptoms, don't ignore it. It's
Right.
not worth it. We're, for example, doing vascular screenings where we check your aorta,
Sure.
carotid, abdomen, electrocardiogram for like $60, just the cost of the staff. You can get these tests done anywhere.
Sure.
It's inexpensive. You can be checked and evaluated. Don't take a risk. You've got young families, especially some of the men that smoke,
Right.
and women, but mostly in
And
our
women.
community, the men are smoking, eating poorly, and they're out there, and they're unfortunately dying at a young age.
Maybe next time is really running out, and the information is really very valuable. But next time, maybe we'll talk about stent. We'll talk. You do it at the hospital, right?
Absolutely.
Every day.
Oh.
And we will talk about. You mentioned something really very important to so many people who are watching us in the Middle East. You're talking about your hospital is education
Yes.
institution,
It's
right?
a teaching hospital.
Teaching
yes.
hospital, and you always need new doctors for residency, right?
Sure.
And I know that so many people from Jordan, Iraq, and the various Middle Eastern countries, they always score high. But
We
they
have
never
trained some of the best doctors have come out of Jordan, from Jordan University, and also from Jordan University of Science and Technology.
Sure.
As a matter of fact, I've had the privilege of training 7 heart specialists from Jordan.
Wow.
And 2 of them are at Jordan University, Dr. Tariq Iksous
Right.
and Dr. Hanan Makhamre. And the third one is
And also, I referred to you maybe years ago, Dr. Ala Haddad.
Ala
and he
Haddad,
works
he's,
with you and other. And they are excelling now in various
well,
universities.
the
But you gave
Jordanians,
them opportunity.
the Jordanian University and the Just University, they do a fantastic job, and we're always happy to have their graduates.
I would like to thank you very much, Dr. Shukri David. شكري داود الطعيمة. أنا مش عارف ليش بنقول دائما ديفيد
That's
شكري
when,
ديفيد
when we
شكري
came
داود
off when we
الطعيمة.
came off the boat, somebody gave us that name.
Right. And الدكتور شكري هو من بلدة الفحيص، أجمل بلدان الشرق الأوسط، مش بس من الأردن، أجمل بلدان الشرق الأوسط. I really appreciate you coming here, and hopefully we'll have you maybe on a monthly basis to educate our community about heart issues and heart diseases.
تشرفنا. It's an honor and a privilege.
الله يخليك. أعزائي المشاهدين، شكرا لإصغائكم ومتابعتكم، وحتى ألتقي معكم في الأسبوع القادم في حلقة جديدة من برنامج ضيف وقضية. لكم مني ومن أسرة البرنامج أجمل تحية، والسلام عليكم.